Dr. Kemi Health, it's Wednesday, the 3rd of September 2025. Let's talk about your health. I am a retired pharmacist and consultant pharmacist now. I'm pretty much a medical consultant, but I'm not a physician. Okay, when you hear Dr. Kemi, it doesn't mean I'm a medical doctor. It actually means that I might have a doctorate in something else, or even a nickname, Dr. Kemi, which a lot of people call me on my pharmacy degree. I am a clinical and retail pharmacist. I was for 37 years. I retired this year, 2025, May 1988 to May 2025. So everything I tell you, and I say go see your doctor, I actually am meaning go see your physician. Okay? My name is Dr. Kemi Olunloyo. I use Dr. Kemi for short as a nickname. So let's talk about when you need to see your physician. There's a lot of things I put together on Facebook, and a lot of people on Facebook found it very helpful. So I'm going to put it together now for you guys on YouTube. Okay, I might even pass this video back to Facebook because you can learn from this and you need to share it. Click share on the YouTube, please share on Facebook. Wherever you see this, just click share. It's very, very important. Okay, so today, the 3rd of September 2025, Wednesday morning, I feel that you should do these things when you see these things. When to see a physician. When you're always tired, your iron may be low. Okay, your thyroid needs to be checked, or you're having something called sleep apnea. Okay, so people have sleep apnea. It's a little different from insomnia, but it really bothers their sleep. So when you get these symptoms, straight to the doctor. Okay, the next one is numbness in your feet. If you have numbness in your feet, okay, points to nerve damage or diabetes. Okay, I have nerve neuropathy. I've discussed that with you. One of my foot is always numb. Okay, tingling, numb, blah, 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 has to do with old age. I went to my doctor. When I went to my doctor had a diabetic test for me, fasting glucose and all that. I went at 6:30 in the morning and I went to see that doctor. The clinic is like in a hospital, so the hospital is 24/7. So I went very, very early. They took my blood, sugar, and everything, and I came back around 1 o'clock for the results. I didn't actually go back there. At 1 o'clock, I called my doctor who got the results from the lab, and he sent it to me on WhatsApp. Now, this is why medicine is changing now. You can use all these messaging apps to send things or discuss on the phone, but you need to check. My sugar level was fine, okay? Mine is nerve damage. And let's face it, I'm 61 years old. I practiced pharmacy for 37 years, journalism for 31 years, and PR. Most of my job includes standing and walking around. You have to really think about how your job is. If you're in the office, it's different. Some of us are standing and walking around all the time. And by your age of 60, you get like really tired and then nerves start getting damaged. So nerves in my leg is stretched. It's only one leg, but I went to find out to make sure I don't have diabetes. So you got to get your blood sugar tested, and then you need to check for neuropathy. The third thing here I have is shortness of breath without asthma. Okay, is a sign of lung issues, anemia, or related to heart issues. Now let's talk about with asthma. I'm an asthmatic since 2 years old. I'm 61 now. If I have shortness of breath, a lot of times I reach for my inhaler and puff it. After using my inhaler, I should be fine. Without my inhaler, okay, sometimes I just like, okay, let's see. After using my inhaler, if I still have shortness of breath, that's a sign, okay? I might have more lung issues. I might have anemia, okay, that's related to heart tissue. So I really should get that checked with a doctor. Next, back pain. If you're having back pain all the time, many of you say you have lower back pain. That may be a sign of vitamin D and calcium deficiency, especially if you're old like me. Old people normally get back pain. And you do get back pain if you sit down a lot as well, because towards the end of my career, okay, to where I am now, from like probably 40 to 60 years old, I started sitting down. Even though I was a journalist, there were times when I sat down hours as a producer in newsrooms in Baltimore and wherever, Canada and all. Then, becoming a digital journalist, most of my 50s, I was a digital journalist. So I'm basically on the internet, sitting down at a table and a desk. So sometimes you get that back pain. But when I started taking calcium and magnesium and vitamin D and all that, things got better. And that comes with your age. If you're older, elderly ladies are going to have a deficiency in calcium. So you need to get that together and get the supplements. But see your doctor to make sure it's not something else. Now, constipation. Constipation is often linked to thyroid issues or low fiber in your diet. Okay, start eating apples and oatmeal, also prunes. The thing about constipation is when it becomes really painful, or maybe you're really having a hard time to poop, or there's blood in your poop, you need to see the doctor right away. You have to rule out things like colon cancer. Your colon is your large intestine, the place where all the food is processed before it becomes poop. So once it gets into that large intestine, it's already reached poop state. It needs to come out of your body. And if it's not, and you're constipated and getting pain, you must see a doctor. A lot of people die from colon cancer. Okay, pancreatic cancers that are involved in digestive systems are very bad. They just kill you like that. So make sure you see your doctor. So frequent dizziness. Okay, I wrote frequently. Okay, frequent dizziness is a sign of inner ear infection. Okay, when you're dizzy, your ear, something's wrong with your cochlea. A cochlea is the inner ear infection. Be careful to make sure your eardrum is not messed up, and please start using those Q-tips inside your ear, because some of you are passing those Q-tips directly into the air just to feel good and take out wax. No, no, no. Get a wax remover, liquid, drop it in your ears, rinse it out with water. That's how it's done. If you're like me, I used to put those Q-tips wherever until I lost the cotton wool 2 times. And in the year 2014, now look at this. This is 11 to 12 years later. In the year 2014, it cost 11,000 naira to remove cotton wool from your ear. So I went to the ear doctor twice. I ended up spending 22K just to get that thing, and the doctor kept warning me. So I stopped. You're only supposed to use Q-tips on your outer ear and not your inner ear. So that's very, very important. I don't know how much the price is now. God forbid. I don't do that anymore. It could be very, very expensive and stuff. It can also be a sign of low blood pressure if you're getting dizzy. Your blood pressure might be low. If your blood pressure is low, try and get a little bit of activity in your body, as in, maybe drink some orange juice. All right, eat a banana. Always have bananas around and orange juice in your fridge, and get some energy on that. Now, irregular heartbeat. That could signify magnesium or potassium deficiency. Potassium is very important to work in the heart, okay? And magnesium also, but that potassium is very, 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 important. That's another reason why I say that you have to have bananas in the house all the time, because some of you are taking high blood pressure medicines and you're taking diuretics like hydrochlorothiazide, HCT. Every time you take HCT, it takes out potassium from your body, okay? It's not a potassium sparing diuretic. It actually takes out potassium. So we give those people an instruction in the pharmacy that they should take that HCT in the morning. Some of your parents are taking it, and your grandparents, or maybe you. They should take it with a glass of juice or a banana. It's very, very important, Now, memory loss. Memory loss may mean like you have a deficiency of B12, vitamin B12. Memory loss. Am I talking about dementia or memory loss? Well, let me explain it to you. I'm going to use myself. I'm 61 years old now. Do I have memory loss? There's been time when I just started working in the day and I forgot it was Wednesday. I thought it was Tuesday still. I've missed out time. And then keys. Okay. Normally keys would be at the door. Your house key would be at the door. Your car keys would be on the table somewhere. A lot of people leave their car keys on the table. I always like to leave my car keys in my bag. Everybody has a if, buts, and whens. I'm a very security conscious person. I don't want someone to break in my house and then take my car keys and go with my car. But I always keep things where I remember they are, and all my keys are in a bunch. Sometimes that's not good, okay? Because if somebody steals your car, they can go to your house and open your door and rob it and stuff. But my thing is, sometimes when you want to go out and drive and you forgot where your car keys are, I always tell people this in America. Even I learned this from someone. Put your car keys in the refrigerator. The side where the eggs are. Put your keys there. What's going to happen? It's going to be a little cold. Okay, I'm not saying do it overnight, but if you can't remember where your car keys are all the time, put it somewhere you remember. Fridge. That's what I do. Finally, Soft drinks with nutrients.